Welcome, everybody. My name is Julia Wall. I am the Director of Education at the Michigan Parkinson's Foundation. We have a virtual education series that's taking place, and we're happy that you could join us. I did want to mention that in 2024, we are going back to our monthly virtual education series, but they will be taking place on Wednesdays at 7 p.m. So look out for a notice about that. I am honored to introduce our speaker, but first I wanted to thank Supernus Pharmaceuticals for sponsoring our talk. They are a wonderful friend to the foundation and definitely a big supporter, and we could not bring you the programs without their support. So Joey is our representative. I'm not sure if he's on, but I do want to thank you for everything that you do to support the foundation. And I'm going to mute everybody, and it is my honor to introduce Dr. Erin Ellenbogen, a movement disorder specialist from the Mind Clinic. Dr. Ellenbogen.
Prevagen, no prescription required. $10,000.
Except I hit mute.
I had to unmute myself. Okay, very good. Thank you. Thanks, Julia. And, as time passes, it's amazing to think how long I've known Julia and how long we've worked together in many different capacities. So, it's a privilege to be here tonight. And, thank you to Joey from Supernus and Supernus for helping to sponsor this evening. And, certainly I'm excited for the walk on Saturday. I think it'll be a great event, and certainly am thrilled to be a part of it. So what we're going to do is spend a little bit of time talking about APOKYN, but I'm hoping that we're really going to be able to really spend most of the time discussing Parkinson's and navigating the journey and how we sort of move through this and why we may select certain treatments at certain times, etc. So to begin with, we're going to just ask you to think about how you go through your day with regard to your symptoms. Because what happens in early Parkinson's disease is that many people experience what some will call a honeymoon effect, but others will actually, from a scientific perspective, we call it a long duration response to medication. There's this misconception out there that levodopa only works for a finite amount of time. And so there was this belief that you should even delay starting treatment for symptoms with levodopa because you want to avoid having it run out in terms of its effectiveness. So I want to start by just correcting that misconception. Although how people respond to levodopa changes as the disease progresses, this is not that the medication stops working. It's simply that we start to see this transition from the long duration response for a dose of medication. And that just means that people can't tell the difference from one dose to the next. And even if they miss a dose or multiple doses, they may not be aware of the increase in symptoms as a result of that. However, as the disease progresses, this response to medication starts to evolve. And what it really reflects are two things. Number one, what's going on in the brain, meaning that there are fewer neurons in the brain that can actually buffer dopamine and release it in a very physiologic, natural way. And simultaneously, remember that Parkinson's is not just a brain disease. Anyone who knows anyone with Parkinson's, and certainly people who are living with it, understand that it impacts the bowels and it impacts the urinary tract and a host of other areas. But in particular, the gastrointestinal system is impacted, and that can impact how medication gets absorbed. And so that can also start to affect how people respond to medication, and they may feel that their medication doesn't work as effectively. And also, it may mean that people start to experience failures of doses of medication. What happens is that when this variability is introduced, especially if it's unpredictable, it can be really, really challenging for people to deal with. And so, in the most simplistic terms, think of it as a red light and green light. And when your green light is on, everything is going smoothly. You can move very well through your day-to-day activities and so on. However, those red light periods are when you have your symptoms return, It may mean that you're moving more slowly, that you're stuck or stopped, or you just see return of symptoms in general. And this can have a profound impact on people and how they function. And so I think it's really important to keep this in mind as we go through. So when we talk about managing Parkinson's, there's a variety of different things that we talk about, and we really need to take a holistic and comprehensive approach. And one of the things, I think it fits very nicely with what Julia was talking about in terms of some of the offerings of the Michigan Parkinson's Foundation. Exercise is a critical aspect. And so we're lucky in Michigan that there are opportunities to have exercise specifically for people with Parkinson's disease. And the opportunity exists to participate at no charge. So whether it's the virtual classes, the in-person programs on Monday, or the fact that there's actually archived classes on the YouTube channel, you have access to all of these things. And I would encourage everyone to really take advantage of that opportunity. The other thing is that medication is really critical. And so when I talk to my own patients, when I talk about the medication is my job, the exercise is your job. Other things that are really important as well, sleep is critical. And we know that people with Parkinson's often struggle with sleep. And so that's something that we work hard on to try to normalize as best we can, with the understanding, of course, that it may never become truly normal because there start to be other things that impact us as well. And the bladder in particular can be one of those main things that disrupts sleep. And so that sometimes is an issue. The other thing that we know about is that having social activity is really critical. And this is critical for people as they age in general. One of the things that has been identified as a key to longevity in blue zones. So these are areas where around the world where people actually live the longest, that social network and social interaction is really, really critical. And this is also true for people with Parkinson's. I had the experience yesterday in talking to one of my own patients about their participation in Rocksteady Boxing. And I think Rocksteady Boxing is a great program. I'm not here to talk about that at this point. However, I do want to point out that one of the key elements to that is not only getting the movement and the exercise, but there's a social element. And as I've explained to many people over the years, that those groups actually function in a way as de facto support groups for that core group of people. And so this patient actually had related to me that his experience was there are times where they don't exercise for that long. They may only exercise for 45 minutes, but they spend another 45 minutes or an hour or sometimes even longer sharing their experiences and what they're going through, and having that social connection is really important. And through the Parkinson's Foundation, there's the opportunity to have that engagement and in a learning environment with the support groups as well. And then diet is also a critical aspect. And so many people ask about special diets for Parkinson's, and there's a variety that have been studied. But what it boils down to so far is there's not a single diet that is recommended, but the idea is to eat a healthy, balanced diet. We know that food can sometimes impact the absorption of levodopa and that it competes with protein for absorption. And so there are times, and it really doesn't matter in early Parkinson's disease, but as people start to transition into that sort of second phase of response to medication, where they start to see the effects of discrete doses, then it may be important to start trying to avoid protein around timing of oral medications. And so that may mean taking medication on an empty stomach, which means about an hour before one eats or about 2 hours after they eat. Even then, it's imperfect because there's a lot of other things that happen. But the key to diet really is eating a healthy, balanced diet. In general, a Mediterranean style diet, which is heavy on fruits and vegetables, using legumes, and then more sparingly with fish, and even more sparingly with chicken, and then red meat even more sparingly. Oils should be focused around things like olive oil. And so this is something that, again, there's no definitive approach, but it's something to really think about. When the disease starts to progress, we start to look at medications that may extend levodopa. we think about on-demand therapies. And then, of course, there are things that may address dyskinesia, which are those extra involuntary movements. But in the end, the goal really is trying to reduce those red lights and reduce those off periods that people experience. And even though we can adjust medications, try to really minimize those predictable times, there are unpredictable times where there are the quote unquote traffic jams or long stops. We've talked about the sleep habits already. We've talked about socials and exercise and diet. So moving forward, we talk about these traffic jams. So just so we're on the same page, when we talk about on time, we talk about when medication seems to be treating the symptoms and symptoms improve. One thing that I think is important to understand is that levodopa doesn't treat all the symptoms, and none of the medications we use for Parkinson's treat all the symptoms. So we start to look at what symptoms respond to medication and what symptoms don't, because that's helpful for each person in their own way of experiencing Parkinson's to identify what may be signs of their medication wearing off. In other words, what symptoms are no longer controlled as the medication starts to wear off. So this can be something like the reoccurrence of tremor, although tremor is not really the best indicator because that's a symptom that often is responsive to external things. So if you were stressed or anxious or cold or excited, so it doesn't have to be just negative emotions, that can really aggravate tremor. And we see this especially when people start to get sick, so that, you know, I saw a patient today who noted that he had COVID recently, and that seemed to really aggravate his tremor. As he's recovering, his tremor starts to quiet down. Similarly, if you were to have something that was really exciting, a positive emotion, that can cause the tremor to act up temporarily. So in many people, it's a sign of slowing down with your movements overall. It can be a sign of just gait issues. And many people, even before they start to notice the motor symptoms of the medication wearing off, they start to feel non-motor symptoms. So it can be preceded by sweating, anxiety, shortness of breath, etc. And so this is something where Parkinson's really is very unique to each person. And so the symptoms and the journey can differ from one person to the next. As far as the gastrointestinal issues, I've already alluded to this, but there are issues with regard to how medication is absorbed. And you can see normal absorption, slow absorption, and then impaired entirely. So normally we see that it goes into the GI tract, gets absorbed, and then gradually makes its way to the brain. When it's slowed, that process occurs obviously more slowly, and in more impaired absorption, we may even see medication not making out of the stomach in a timely fashion, and therefore we start to see that people can experience dose failures where their medication doesn't seem to work. So one strategy can be taking medication on an empty stomach, where that can potentially help and get around these roadblocks. Here's just a photo that you can see where someone took their medication about an hour and a half before, and not only do we see it still sitting in the stomach, but more of an issue is the fact that it hasn't even dissolved yet. And so this is something that we see sometimes related to medication. So people who are on medications that may reduce stomach acid, because we need an acidic environment to actually help dissolve medication. So sometimes we will actually encourage people to drink something that's a little bit acidic, a carbonated beverage, where a small amount can just provide that extra acid. So this gets solubilized and dissolved in that liquid and is more easily transmitted out of the stomach into the small intestine where it gets absorbed. So as I mentioned, off symptoms can appear different for everyone. In the motor side, it can be feeling stuck. It can be recurrence of tremor. It can be the stiffness or slowness, walking problems, changes in speech, as Julia had mentioned. We do see those changes in speech that occur with Parkinson's, and sometimes that can fluctuate with how the medication is working. And off periods may look different at different times of day. So just because an off period is one way in the morning, it may look a little bit different in the afternoon. And so things to keep in mind are, how bad is it? When does it occur? What are the symptoms that occur? How often does this happen, and how long do they last? So just to give you an idea of how common this actually is, there are many people that start to experience off episodes within 2 years of starting levodopa. When we look at one trial, the L-DOPA trial, which took a look at people who were in the very earliest phases of Parkinson's, they were newly diagnosed, and the average time that patients in that study or participants in that study had been diagnosed was about 3 months. They gave these people various doses of levodopa or a placebo, and what we ended up seeing in this study, and it wasn't the main point of the study, but about 14% of people in this study actually experienced these off periods as early as 40 weeks. So this is something that isn't necessarily a late finding. And by 5 years, roughly half of people will experience some of this wearing off. By 10 years, we see about 90% of people experience off episodes. If they are predictable, then that really just means that we have to change foundational therapy and try to adjust medication regimens so that we can minimize those. But as they increase in frequency, severity, and certainly unpredictability, then we need to start thinking about other strategies. Other things that are really important are the fact that we need to treat off episodes that can interfere with someone's function from day to day. So, if a person attends rock steady boxing and they turn off during that, that can really impact the benefits that they see. Another person may notice that their medication hasn't kicked in when they have a doctor's appointment. So now that individual is concerned he's going to be late for his appointment. And for others, it can happen when they're out to dinner, take medication before dinner, taking an empty stomach, but yet it's wearing off and unable to get up from the table. So again, we need to think about the fact that despite levodopa and other Parkinson's medications, people may still experience these off episodes and certainly can become more of a challenge. So one strategy to address this are on-demand therapies, or what sometimes people refer to as rescue therapies. But really, the key is that this gives people control over how they address and manage their symptoms. So the idea, of course, is that with that control, you can minimize the impact of these off periods in day-to-day function. And so these studies were conducted with Apokyn, and everyone who was in the studies actually were on levodopa, and many were also on other medications. And people were observed and motor function was assessed at planned visits, but there was also diary information that was gathered in order to assess how many off episodes people were having, how long they lasted. And what we found in these studies with Apokyn are that people started to notice improvement in some cases as early as 7.5 minutes. And certainly by the time 10 and 20 minutes roll around, we start to see improvement. And the key is that the goal was actually achieved, that Apokyn was able to really mimic the effects of levodopa. So it provided a response that was very similar to how people responded at their best to their levodopa therapy. So one of the things that makes Apokyn really valuable is how reliable it is for people. So it reverses about 95% of off episodes successfully. So that means only 5% of the time when people use it do they not get a reversal of those off periods. Again, 7.5 minutes, so it can work very, very quickly, but also seen at 10 and 20 minutes. And again, at the 20-minute mark, people achieved an effect that was very similar to their best oral levodopa-like response. And so that certainly is the goal with any medication, is to optimize that response and do it quickly and reliably. So just a few safety things about Apokyn. It's an injection, so that's one thing that people, I think, need to know. And it's something that works in the dopaminergic system. So just like levodopa and other dopamine agonists, Apokyn is a dopamine agonist. It can cause dopamine-related side effects. And so this can include trouble staying awake during the daytime, having lightheadedness and drops in blood pressure. Certainly, we know that if people have any liver, kidney, or heart problems, you want to have your doctor be aware of these issues, which they should be anyway. And then if people have had any major psychotic disorders in the past. Certainly, this is not something that has been studied in people who are pregnant or breastfeeding, and so it's not known what impact this may have. Furthermore, if people are taking medications that drop blood pressure, such as nitroglycerin, then you need to be careful because someone who needs Apokyn and has an issue where they need to take nitroglycerin, both of these medications can drop blood pressure together, and so it increases the risk of having fainting episodes. So someone should lay down after doing that. And then, of course, people shouldn't drink while using this medication, drink alcohol while using this medication, and not operate heavy machinery until you know how Apokyn affects you. And because it can cause drops in blood pressure, it's something that people need to be aware of, not getting up too fast, simply because that can provoke a drop in blood pressure, cause lightheadedness, and in severe cases, even lead to passing out. So I spent some time talking to you about how the gastrointestinal system is impacted in Parkinson's and why that plays a role in medication impacts and the unpredictability and dose failures and so on. So one of the keys about Apokyn is that because it's an injectable medication that's injected under the skin, it's sort of like an EpiPen, and it bypasses the GI tract. So this is a shortcut to get it into the bloodstream and into the brain rapidly, which is why we start to see it working as quickly as 7.5 minutes, and why most people have achieved a full on mimicking their best response to levodopa by the time they get to 20 minutes. Furthermore, the effects of the treatment will last only 60 to 90 minutes. So as you can imagine, this is not the foundational therapy like levodopa is, where hopefully the response to medication is lasting several hours. But when there's those times that occur where your oral medication stops working or doesn't work as effectively as you want it to, then you can use something like this on demand. So if all you're planning on doing is sitting and watching TV when you have an off episode, that may not be the right time. But if you think back to some of the scenarios that were set, that person who's in the restaurant and all of a sudden their medication is worn off and they can't get up from the table, that may be a time where someone can discreetly dose themselves with this injection, and within a few minutes they're able to start moving again, and certainly by 20 minutes they're fully on and are able to function like their best response to oral medication. And so this gives people control of the when they want to use this, and because of that reliability where it seems to work about 95% of times, it is also something that gives people that assurance that it will work when they want it. The other thing, and this was a study I was actually involved in, is that this is something for some of my patients we use to jumpstart their day. And what I mean by that is typically when a person takes their oral medication in the morning, the average time for that medication to start working is about 45 minutes. Some people, unfortunately, it can take even longer. And so we did a study looking at dosing people in the morning with Apokyn. And what we found was that when using Apokyn and taking their oral medication at the same time, we found that 96% of people showed improvement in their time to turning on in the morning. So that time for reversal of their Parkinson's symptoms first thing in the morning. And we saw motor improvements in the ability to walk, talk, and move around within 15 minutes. And morning on time also improved by about 37 minutes. So this was one of these studies that really, was shown that it can safely be used in the morning, B, that it nicely augments oral medication and can help jumpstart the day in terms of that. So we talked about the situation of this gentleman who was out to dinner on a Friday night. You can see that Marvin, who has a doctor's appointment, certainly using Apokyn on a morning where he has to get somewhere and know that his medication is going to kick in reliably and quickly. Using Apokyn along with his oral medication may be one way to achieve that. And then if someone is exercising and finds that their medication is wearing off and feeling stuck, then that return of symptoms may also lead to people using medication. And I have one patient who recently we talked about using an on-demand therapy for when he's on the golf course, because he knows that during that 4 hours that he may play 18 holes, that his medication will wear off and he wants something to have that extra degree of protection and know that he's got something in his back pocket, in this case, literally, that he can use to treat his off periods. So what are some of the possible side effects of Apokyn? This could include things like allergic reactions, such as hives, itching, or swelling. If you inject it into a vein, it's intended to go under the skin. If it were accidentally injected into a vein, it could cause a blood clot. If it happens, it's really not the end of the world. It's just one of those things that needs to be identified, and then it can be treated appropriately. People can experience nausea and vomiting from this medication. I'd already mentioned that people can have sleepiness or falling asleep during the course of the day, lightheadedness or dizziness, certainly associated with a drop in blood pressure. That drop in blood pressure can also increase the risk of falling. We know that medications that treat Parkinson's have the potential to cause hallucinations or psychotic-like behaviors, and Apokyn is also one of those medications that this is an issue with. Uncontrolled movements or dyskinesia. In my experience, most people who experience dyskinesia when they're taking Apokyn experience dyskinesia already. So it's not something that is necessarily newly provoked by Apokyn, but is something that can bring out dyskinesia that pre-exists in people. And then if you have any symptoms of becoming pale or fast heartbeat, more tired or weaker than usual, especially if there's any jaundice or yellowing of the eyes or skin, that can be a sign of hemolytic anemia. It's a very rare condition that can be associated with this. So as a reminder, Apokyn does work quickly and reliably as early as 7.5 minutes. It is certainly by 10 minutes, and then 20 minutes people are fully on, and it can be used as needed up to 5 times per day, as long as those doses are separated by at least 2 hours. But this is to supplement oral medication. And so you can see here that this is an example of someone injecting themselves, and it's really simple. It can be quite discreet, holding the pen device to the skin, and it'll deploy the needle, and holding the button down